it should be recording. And go ahead, doctor. Thank you.
Okay. Hello. I am Dr. Nishadko. I go by Kat. I went to medical school at the American University of Antigua. I finished residency in Ohio, and I've been back in California for about a year and a half, working outpatient family medicine for Optum, which has been really wonderful. I enjoy going outside, outdoor activities, spending time with my husband and our 2 dogs. California has been the perfect place for that. Things have changed obviously due to COVID, but we're still trying to do those activities safely. Mental health, it's a really important topic, especially during this pandemic. We're living in a time of really great uncertainty. A lot of people don't necessarily know where to turn to with their feelings and their emotions, and your family, your friends, and of course your clinician is somebody that you can always turn to. Overall, during this time, I think our mental health is suffering, so I wanted to discuss depression and just go into some detail on the topic today. So what is depression? So it's a mood disorder, and people that have depression will have feelings of sadness, emptiness, hopelessness. Sometimes they have decreased interest or pleasure in doing things that they used to enjoy before. They'll notice those types of feelings. They don't want to wake up in the morning. They don't want to get up and maybe go to work or, go to the gym, exercise, things like that. They'll potentially have changes in their weight because of increased or decreased appetite. They can be sleeping too much or too little, and unfortunately, also some people have thoughts of death and potentially hurting themselves. So it's a difficult thing to be diagnosed with and have to deal with every day. Depressive episodes, they can range from mild to severe. Just really depends on the person and the episode. But if you do have at least one episode of depression, the risk of you having another episode increases. So it's something really to keep an eye out for. Who can get depressed? Any of us. It doesn't matter your age, it doesn't matter your race, your social economic status. Anybody can unfortunately get depression, and it has been found that women are at increased risk. So 1 out of every 10 people that goes to the doctor has depression. So if you have depression or you know somebody that does, it's a very common diagnosis, and a lot of people are dealing with it currently. If left untreated, and depression can lead to a poor quality of life. So it's something to really get diagnosed and to address early on. A lot of patients come to me being like, oh, I'm depressed, and I think it's just because I'm getting older, but it's actually not normal. It's not normal to be depressed as you age. So that's a misconception. However, the rates of depression are higher in older adults. So studies show that about 50% of nursing home patients and residents 65 years and older are depressed. So that's a very large amount of people. And depression may be the first symptom of a number of medical conditions that can affect the elderly. So comorbidities, diabetes, cancer, strokes, thyroid problems, heart disease. Depression does affect these comorbid conditions. Some risk factors for late life depression: being a female, as I had said before, social isolation. So right now, with the coronavirus pandemic, we're socially isolated. We're trying to keep our distance from other people, so it does increase the risk for depression. Being widowed, divorced, lower socioeconomic status, having comorbid medical conditions, diabetes, lung disorders, people that have a lot of pain, people that don't sleep well, cognitive, functional impairments, wheelchair-bound patients. So these are some important risk factors. So the elderly, they account for nearly 24% of all completed suicides. The elderly attempt suicide less than younger patients, but they are more successful. So this is something really to keep in mind. And white men over the age of 65, they're at the highest rate of completed suicide. Dementia. So late life depression, it's associated with an increased risk of developing dementia. This is its own actual diagnosis. It's called dementia syndrome of depression. And this can be treated. Antidepressants can help resolve the mood disorder and the cognitive symptoms that happen with depression and dementia together. So patients that come into my office, we normally ask these two questions. It's just a screening tool. So if you answer yes to either of these, then we go on to a longer questionnaire. So the first question is, during the past month, have you ever been bothered by feeling down, depressed, or hopeless? And then the next question is, during the past month, have you been bothered by having little interest or pleasure in doing things? If you answer yes, then we go on to this longer questionnaire. After tallying up the questionnaire, if the score is greater than 10, then the risk of depression is much higher. So treatment aspects, how do we treat depression? So there's two main ways, and normally you want to do these treatments together. So there's psychotherapy, cognitive behavioral therapy, counseling. So this is all pretty much the same thing. You go to your behavioral health specialist and you pretty much find out coping mechanisms and how to deal with your depression. And then depending on the severity of the depression, you can also start medications. These are antidepressant type medications, and there's many out there. When patients initially try these medications, it's really dependent on you and partially also your family history, if there's been any depression in the family, any behavioral health disorders in the family, and what medications your close relatives were taking. Sometimes it's proven that the medicines that help them will help you. So we just start the medicine and the cognitive behavioral therapy and see how you do there. A lot of times when I tell people that I suspect they have depression, a lot of people are in denial, and this is the first thing to really overcome, because number one, you just have to address your emotional state of mind and just really understand where you are at that particular time. Forgive yourself, forgive others, for things that have happened in the past. A lot of depression stems from past experiences and past things that people have had to deal with. So that's an important thing to address. And if you were diagnosed with depression, it's power. You know that you have that diagnosis, and there's ways to deal with it and help you heal. So it's not the end of the world. There's a lot of different ways to help you heal and deal with what's going on in your life currently. So the goal, it's to reduce and eliminate your symptoms overall, just to make you feel better, have you enjoy the things you used to do, enjoy spending time with your family and your friends and everybody around you, and also just to prevent the depressive episodes from getting worse and from recurring. So number one, you think you have depression, just talk to your clinician. So we can do whatever we can to help you and get you towards the right path. If you're prescribed medications, make sure you take them the right way. If you don't take the medications daily, then the medications aren't going to work as well as they should, and you may feel discouraged because of that. So it's really important, take your medications. And if you're having side effects and potentially that's why you're not taking them, just let your clinician know so we can change the medicine. As I said, there's so many different treatments out there. So the first one you try is not going to be the last one. If you're feeling suicidal, tell somebody, and if it's really severe, go to the emergency room so that it can get taken care of and things don't get out of hand. And talk to your family, talk to your friends, so you have the support system that you need and you're not feeling alone. And then overall exercise. So if you're able to exercise and you're not having a heart condition that doesn't allow you to do so, or you're wheelchair bound, or whatever the situation is, if you're able to exercise, do it. Just get yourself out of bed in the morning, 30 minutes a day. So it increases the happy brain chemicals. So that will help improve your mood, your immune system, and it'll help decrease the stress, anxiety, depression symptoms that many people are feeling. You can do walking, yoga, and actually Tai Chi has been proven to be really good. And it even helps with balance. As people get older, they lose balance, increased risk of falls. So that's really a good way of exercise as well. So overall, these are a couple of the topics. And I hope this helps everybody get through the difficult times and the depression that many of us are feeling during this time.
Any questions from anyone? If no one has a question, I have a question.
Yeah.
So I guess what is a good way to distinguish between, like you said, a depressive episode versus like depression? It's like, for example, like with my grandmother, my grandpa passed away a year ago, and since then, she really hasn't been having any interest in things, and she originally said she was going to start going out to senior centers, and then obviously everything happened with COVID. So just being stuck in the house obviously is, depressing. So is that more of a depressing episode, or I guess like when does it get out of hand to the point where it will be like a chemical imbalance?
Well, that sounds more like bereavement as well, right? Because your grandfather, you said, passed away? Yeah, so the two diagnoses, bereavement, grieving, sadness, all that, and then the depression, it could definitely be part of it. So it really is a timeline. As long as it's going on for a long extended period of time of more than 2 weeks, and yeah, that could be depression due to losing your grandfather, unfortunately.
Yeah.
So you've got to, yeah.
So I'm just wondering when for like her or for anybody, even now during like with COVID-19, when does it become like from a depressive episode to something that will maybe need to be managed by a clinician? So I guess you're saying like if symptoms get worse, or obviously if you're having like.
Well, if it's happening for more than 6 months and she's not going out and doing her daily activities and doing the things that she used to like to do, then yeah, then it's something that should be addressed. And I don't mean necessarily, like I said, with medicine, like just talking to somebody and just acknowledging that, you're sad and feeling lonely. And it might be easier to talk to somebody other than your family members at times. You might want to just have like an ear of somebody that you've never actually, met before, or somebody that's not there in your daily life to talk to about it.
Thanks for the advice.
Yeah.
Any other questions out there? Don't be shy. I can take some people off of mute that may not know how to take themselves off of mute.
So is this presentation at One Health at a nursing home, or who exactly is on the line?
So Jenna, do you want to take the opportunity to talk a little bit about ONEgeneration?
Yeah, definitely. So sure. This audience typically is for older adults that may have been engaged in our senior enrichment center prior to COVID. We had over 2,600 members enrolled here, about average daily attendance of about 250 older adults. Like most other nonprofit organizations, we had to figure out how to, redirect and pivot our programmings to continue to meet the needs. So this is actually one of our first health presentations via Zoom that we're offering. So we're still, testing it out, seeing what older adults are able to listen in on and what their needs are. So yeah, that's kind of what we're doing right now. And
okay,
we want to thank you guys definitely for being our, I guess you can call it guinea pig for health,
anytime.
Health education presentation. We have been offering a lot of different exercise classes, Zumba and chair exercise,
Okay.
and other classes like that, which have been pretty successful. So we're starting to incorporate more of these doc talks and health education, because we know how important it is, especially now, more than ever, especially mental health. Being at home, older adults already face isolation as it is. So, taking a population that wasn't necessarily homebound and they were active and engaged in their community, and forcing them to stay at home is going to really cause a huge impact on their overall mental health and their isolation factors. And I don't even think it's for just older adults, but for anybody in general, for children and families.
I think right now this topic is important for everybody.
It is. So so we're really trying to just engage as many people as we can in the community, not just older adults, but just anybody that's at home and that need that, additional connection and, engagement with the community in other ways that's not in person. So.
Thank you. And so, Jenna, so how are you with the recording? Do you guys share this with your members? Because I know you guys are still doing your newsletters, or for those who maybe don't know how to get on Zoom or maybe just can't get on at that time, are they still, are most of your seniors who at least attend it daily, are they still pretty engaged with you guys and like checking in and to stay active?
Yeah. So the goal, hopefully, we're going to be any webinar that we have, we're going to record it and then we will upload it. We want to still, for people who wanted to listen in or wanted to attend, maybe did not know how to, they are pretty savvy with our bi-monthly newsletters. So we'll make sure to include this recording link in our newsletter. So for anybody that does read and is somebody that's going to be reading our newsletter on a regular basis, and they can just at least click on the link and watch the recording, we want to be able to make that option available for them as well. Just the whole kind of trying to be as flexible and ever changing and ever evolving programs here, and trying to just meet the needs of our members.
Yeah, same here. And I'll just take a minute to speak about that, as you spoke about, very important during this time to make sure we stay fluid and find other ways to do what we used to do in different ways. So I just wanted to take a second to mention that we are doing video appointments through our Follow My Health platform for seniors or any patients. And I know, Doctor, you can probably speak more to this. I know some people are actually coming in person now since, things were, well, they were getting a little bit better with the coronavirus, but just wanted to mention the new program that we have for seniors who maybe they don't have access to smart devices or they don't know how to use it, where one of our teammates will come to their home with the iPad, of course, disinfected and ready to go to speak, for example, to Dr. Shako for their appointment. And once the appointment is done, then they can, return the iPad, and of course it'll be disinfected before it's passed on to another person for their appointment. So just wanted to speak to how we're trying to get creative and making sure we are able to do appointments virtually and things of that nature, but also while recognizing that everyone may not know how to use these platforms or may not have access to the tools. So just wanted to mention that, and not sure if you had anything to add, Dr. Nishako, on the effectiveness or just anything that you've been hearing regarding the video appointments.
The people I've spoken to through the video, they're really appreciative of it. A lot of people, like you said, don't want to come in. There are the select few that, are able to, but the people that are higher risk for COVID and negative outcomes, it's perfect that we're able to do the video calls with them. And a lot of people are not having too much trouble with it by Follow My Health. I know some people that don't have access to an iPad or a computer, we're going to hopefully be getting them to come to the office at least closely, and then we'll come down and give them the iPad through the car. That's going to be the next thing that we're going to be trying to do, just to keep them outside, out of the office, but still to give them access with the iPad.
Yes, thank you. Any questions on that, anyone? But thanks for mentioning that. Definitely something that I'm really happy
that'll be good.
Organization was able to do during this time, while recognizing everybody may not or know how to or have the tools to do.
Exactly. Yeah, you never know.
Glad that we're still able to keep up, because I mean, even with the COVID-19 going on, it's still important that everybody is, of course, taking care of their other health needs. You may not get coronavirus, but I don't know, you may have diabetes that's out of hand or whatever else type of disease. So really important, right, to manage these chronic diseases and other illnesses, and just getting their regular checkups, mammograms, whatever that may be. And I just have one more question for you, if no one else has any questions. I don't have any kids, but obviously I know that not everybody, excuse me, that some women go through postpartum depression. Um, Maybe with the hormone imbalances or things of that nature, but having postpartum depression, could that potentially put you at risk for depression later on in life, since you already experienced that one depressive episode or went through that?
So you're cutting in and out, but I heard, does postpartum depression increase your risk for future depression?
Yes, that was my question pretty much.
Yes, it does. It definitely does. Anything that happens during the pregnancy period and postpartum has to really be monitored for the future, just because it does increase risk. So even if you've got like pre-diabetes and then all of a sudden you have diabetes during pregnancy, it needs to be monitored. If all of a sudden, you have these mood changes and you have depression, that needs to be monitored long term, especially not only for the safety for the mom, also for the baby.
Mm-hmm. Thank you. Yeah, I was just interested in that, as you said. Females typically being, I guess, more at risk for depression. So very interesting. Maybe because we feel like we have to keep the world on our shoulders, or maybe just something else.
Oh yeah. Plus, you're taking care of a new being.
Yes.
It's a lot of pressure in itself.
Yes.
Mm-hmm. So as long as you're healthy, that increases the chance that baby's going to be healthy, and so your health is number one always.
Yes, of course. Any other questions out there, anyone, before we wrap up? All right, if not, I just wanted to thank everyone for joining. Oh, did you have anything to say, Jenna?
Yeah, I was just going to ask if you can maybe go back to the contact page that way. There we go. There's a phone number at the bottom. That way, if there's anybody has any other, there we go. Yeah, this contact information in case they want to get a hold of the doctor.
Yes, please take note. This of our address, the phone number. You can call for any questions. If you'd like to select Dr. Nashako as your primary care physician, we'd be more than happy to welcome you to our office. The address there, Roscoe Boulevard, right across from Northridge Hospital. Also, we do have an urgent care center in Northridge, located nearby this office, also on Roscoe Boulevard. After hours care and weekend care, if you have anything that's not urgent enough for the emergency room, but you can't wait until Monday to get in touch with the doctor, then we do have our urgent care center, which you can see some fine physicians there and get any of your needs taken care of, get any prescriptions filled, etc., stitches, what have you, anything that's obviously not life-threatening that you'd like to go and see. We do have an urgent care center there.
And I actually work at the urgent care on Mondays 5 to 10 as well, after my regular day on Mondays.
Okay, perfect. So
a lot of people are catching me there if they can't get me in the office.
Yeah, good. If you can't see her Mondays at 8 to 5, then good to know that you are there also after hours. So thank you so much, everyone, for joining. If you're listening to this recording after the fact, please take note of our number and go ahead and call if you have any questions. Other than that, we look forward to doing more of these events in the future. And as everyone gets, more acclimated with the virtual realm, I'm sure we'll be more willing to join these, and just really appreciative of the additional resources that at least we can provide to people, even though, we're all stuck together at home, but, doesn't mean we have to be bored at home. So thank you so much, Dr. Nashako, for the information.
Okay, thank you for having me.
Everyone learns something. Take care, everyone.
Okay. Take care.
Thank you.
Bye.